The ratio of movement of the scapula is a 2-to-1 ratio between abduction of the glenohumeral joint and the upward rotation of the scapula. Sometimes we miss this. We focus on that pain that develops at the anterior shoulder, but we don't necessarily focus as much as we should on movement of the scapula. So sometimes the scapula is so tight that it doesn't allow proper movement of the glenohumeral joint, and so the anterior shoulder becomes hypermobile. A couple things that are involved here, and this is in relation to the term scapular dyskinesis. Sometimes we can have problems with the subscapularis, and we'll have to go in there and get into the subscapularis muscle and release that to help get the scapula moving properly. The other thing is, what I like to do to check scapular excursion is to have the patient put their hand behind the back, which causes the scapula to flare out, and then I try to see, can I get my fingers underneath their scapula? So in Jennifer's case here, I can't get my fingers into there. So what we'll do is I'll use my chest to push back on her shoulder, and I'll try to work my fingers in there and get underneath that scapula. When I get it underneath the scapula, then I'll try to pull it out and traction and relieve some of that tension, that spasm that's in the rhomboids. I can't do that in her, so we have to take a step back, put the hand on the opposite shoulder, and then I'll start working on soft tissue at the medial border of the scapula. Usually these patients will be very tender, but this is a major component of what the problem in their shoulder is. We need to always look at this in any type of shoulder complaint. So it might take a few visits to get this part of it loose. We're also going to be adjusting any subluxations or fixations in the thoracic spine. We're also going to have the patient do some rhomboid exercises like rowing exercises or pull downs or pull backs, things that are going to bring the shoulders back, bring the elbows back, squeeze the shoulder blades together to contract these muscles, because we've developed this forward roll of the shoulders, and it's due to having too much time with our hands out in front of us, not enough time opening up those shoulders. So just to look at what the other side looks like, go ahead and have this left hand behind your shoulder, and again, her left shoulder isn't near as bad, so see, as I'm pulling this back, I can get my fingers underneath there a little bit, and we would pull that out. Now, like I said, it's going to take a few visits just working on this soft tissue. After a few visits, you're going to be able to get that scapula to come back, traction that out, and get some good movement on there. I've seen this on a lot of patients where the scapula is one of the keys to getting that shoulder functionally moving correctly.